Hello, everyone. Good morning, good afternoon, and good evening, everybody. On behalf of BITOSA Global and its chapters here in the US, the BITOSA Texas chapter, as well as BITOSA Silicon Valley chapter, we would like to welcome you all to this very, very interesting, very insightful webinar, which we have been hosting now for the last several weeks. We are, of course, both privileged and honored to welcome Honorable Aseem R. Mahajan, who is the Consul General of India based in Houston, Texas, and our distinguished alumni, Mr. Jagdip Ahluwalia. I'll, of course, leave it to him to introduce himself. And he is a very distinguished alumni, including a faculty member at the Birla Institute of Technology in Mesra, Ranchi. I know we have today a few of our attendees who are actually not from BIT Mesra. So I'm going to just spend a few minutes to quickly give a little overview on the campus and the institute. So BIT Mesra, for those who don't know, and of course for the people who are already here on the call, started almost about 60 years ago in the state of Bihar then, and now of course the state of Jharkhand. It's a fantastic campus, not because I'm there, because of the great prominence it has attained over the years as a very premier institute for engineering and many other faculties. It has grown in strength from year to year, and among its distinguished history, it has many firsts. And I don't know if Honorable Consul General knows, but BIT Mesra was the first one to have actually the Department of Rocketry and Science in all of the country. So we were a premier institute that focused on science and rocketry. It was also the first institute, I don't know if our BIT alumni knows about it, that actually started the entrepreneurship program way back in the 60s. And it had the first science and tech part for students that were interested in entrepreneurship venture, and that space was just outside the campus. So it has boasted a lot of first, and we're very proud to be its alumni. Our alumni strength has grown from, I would say, year on year, and we have over 100,000 alumni spread all across the world. Of course, predominantly in the country of India. So, with that quick background, I would once again like to welcome everybody. We're looking forward to a fantastic session. We're of course once again privileged and thanking our Consul General from India out of Houston. And I'm going to hand it over to our distinguished alumni, Mr. Jagdip Ahluwalia, to take this proceedings forward. So Jagdip, over to you. Thank you.
Thank you very much, Arup. We are actually very privileged to have such distinguished alumni as Arup putting together our group, because we have, thanks to the BITOSA alumni group, reconnected with former colleagues from our teaching days, former students from our teaching days, and former classmates. So it's a privilege to be part of this very distinguished group. And it's an honor to welcome the Consul General of India in Houston, the Honorable Aseem Mahajan, who, for the benefit of those who do not know, is an alumni of BIT Sindri, another very, very distinguished engineering institute in the country. So we are honored to have him. A little bit about my background. I was an engineer because I had no option. I was the son of an engineer, the only son, and my father had a manufacturing unit in Ranchi, so I had to go to engineering school. So while I was working for my father, I was invited by Dr. Pandey through Gopal Pathak, who many of you may know. He is now the chancellor of the Bihar Institute, the Jharkhand Institute of Technology. But he was one of my classmates, and he invited me on behalf of Dr. Pandey to come back and teach in the production faculty. And I did that from 80 to 86. Enjoyed a lot of the extracurricular activity. One of my former students reached out to me after this email, reminding me that he'd gone with us to Sindhi when we came back with the quiz shield. We also hosted the National School of Drama on campus, which trained some of our own students, and we won a lot of national awards at different inter-college competitions. So I enjoyed being a student at BIT, I enjoyed being a teacher at BIT, and I enjoyed being involved in the extracurricular activity there. So I'm very, very proud to be part of today's group, and I'm honored that the Consul General, despite his busy schedule, has accepted today's invitation to be part of this informative webinar. I know he can't answer all the questions, we will not be able to respond to specific questions, but he has agreed to give us an overview and then we will handle some questions. Consul General Mahajan joined the Indian Foreign Service in 1998. Prior to assuming charge as Consul General of India in Houston in January 20, he was Ambassador of India to the World Trade Organization in Geneva. In his earlier diplomatic assignments, he had served as the Deputy High Commissioner in Indian missions in Kuala Lumpur and Dhaka, and as the Consul General of India in Osaka, Japan. He has also served in Indian missions in Tokyo and in Laos. In his stints in the Ministry of External Affairs, New Delhi, he has served as various desks handling affairs related to the United Nations, Bangladesh, Sri Lanka, Myanmar, and the Maldives. Besides, he has also served as the staff officer to the Minister of State for External Affairs and as Joint Secretary coordinating the management of the annual Hajj pilgrimage from India. He has a master's degree in diplomatic studies from the University of Oxford in the UK, a master's degree in management studies from the Birla Institute of Technology and Sciences, Pilani, and has completed 2 annual training courses in the World Trade Organization law from the advisory centers on WTA law in Geneva. He speaks Japanese, apart from English, Hindi, and some other Indian languages. He is married with a son and a daughter. And on behalf of the community of Houston, I want to state that we are very privileged to have you here, sir. You have proved to be a true friend of India, a proud representative of the President of India, the Prime Minister of India. We could not have had a better first citizen here, who's always available to try to solve our problems. And as on behalf of the Chamber, we enjoy working very closely with you on mutual areas. With that, I would like to invite the Consul General of India, the Honorable Aseem Mahajan, to please make his opening remarks, after which I will come back with some questions that we have received from the alumni. And in the meanwhile, if anybody has some other questions that they think have not been covered, you can type them into the chat box. Depending on available time, we will come to them. Otherwise, if we cannot cover them in the program today, we will forward them to the consulate for consideration. Sir, I would like to hand over to you, the Honorable Aseem Mahajan.
Thank you, Jagdeep. Thank you for that introduction, Mr. Roop, and other members of this BITS, Mesra Ranchi Alumni Association. I also happen to be from a BITS, but that is Birla Institute of Technology and Science, Pilani, which also we are proud of, a very big alumni association globally, as all of you would be aware. Because I know the theme of this, the webinar we are having today is essentially to support the community to answer what is on the minds of people in this pandemic. So let me give you a quick brief overview, and then I will be happy to answer and address any of the queries and questions which come up in the webinar. So since the middle of actually March, all our consulates, embassies all over the world have been working 24/7 to basically address this pandemic and the situations which it has created. This is actually an unprecedented situation. We have never been used to a pandemic seen a pandemic like this. Neither we have all been trained to deal with a situation like this when the whole global system, all countries of the world are affected together. International flights have stopped and countries are trying to take various measures. There have been lockdowns. So it is I think first time in at least my lifetime and many of our other people who would have seen this kind of a crisis developing. Now, in terms of our response in the consulate, let me broadly give you the 4 or 5 broad areas in which we have been trying to help people and in which we have been receiving queries. The consulate continues to receive hundreds of mails and calls every day. So during these last 2 months, I think we have already crossed many thousands of calls and mails, and they essentially are from people who are stranded here, who are caught because of this pandemic in difficult circumstances. These are visa-related issues. People who are connecting from United States, they are aware of the H-1B visa, they are aware of the L-1 visa issues. Then there are many short-term visitors who came here on research visas. We have a very, very large number of students. I think Indian students are amongst one of the largest foreign students in United States. They come in large numbers every year. And these Indian students across United States, they are studying in various institutions. So many of them, they were impacted by this pandemic. Then we had short-term visitors, tourists who came here and who were stranded here because of, because of no flights. We have people who have run out of medical prescriptions, people who have been caught by medical emergencies. And then we have, many other people who are basically who have been laid off or who are wanting to find jobs or who are trying to deal with a situation which they never anticipated. So these are some of the things which, we are dealing with. But we are really proud of the Indo-American organizations based here, like Jagdeep's, Jagdeep represents the Indo-American Chamber of Commerce of Greater Houston, which is a very good partner for us. We have been collaborating very closely, but similarly, we have many social, religious, community, and other organizations. And let me mention that one of the things which we are really proud of, and I'm really happy, is that people have risen to address this situation. Whoever could help in any manner has reached out to us. If there was a group of stranded people somewhere, if there were issues related to boarding or lodging, if there were people who are unable to go back home because of various reasons, they have come out and supported us. And finally, of course, our mainstay work, which is the Indo-American relations. The relations between India and United States, we have a comprehensive strategic partnership, which is one of the most important relationships. And we are cooperating. It's a very multifaceted and deep relationship. We are cooperating in many areas, including security, defense, commercial and economic ties, political relations, cultural relations, people-to-people exchange, education, science and technology. So it's a very wide canvas of areas. Finally, on what we do here on our trade and commercial side, which may be of interest to many of your alumni members, we have a large number of Indian companies based here. A large number of American companies are looking at investing in India. The number was 2,000 American companies are there. The number is growing. Over 200 Indian companies are here. Many have representative offices, and investments and trade between both countries are going. President Trump visited India in February. This pandemic has actually come at a time when of course, this could not be timed, but I'm sure as once situation and things normalize, we look forward to strengthening our work in that area as well. So with these words, I will pass it on to you, Aruti, and to Jagdeep, and I'll be happy to answer any specific questions and queries which people may have.
Thank you, Consul General Mahajan. You have covered very well the overall situation. And I would like to point out to all the participants today that the moment the Consul General arrived in Houston, he was very proactive about not only the community side of it, which he has hosted a series of events focused on the different subsects of our community, including a recent virtual Eid Iftar and other programs. He has also joined community organizations when they have reached out to the city or other organizations to show support during the pandemic. So I don't know how he manages to do it, but he probably has 48 hours in a day. And as a community member, we want to really appreciate the great work you're doing. But coming back to the questions that came in today, a lot of them were related to regular consular services like the renewal of Indian passports and applying for an OCI card. There were some questions about issues like getting an affidavit signed, because I understand that the consulate was closed for visitors for a period of time, and people want to know when can they come in for some important affidavits that they need notarized for some important reasons back home in India. There are a lot of questions about the Vande Bharat mission flights. People want to know how selections are made for the flights. How long will this initiative continue? Will all the people stranded be able to get back? I'm just reading through a series of questions that I will then be asking in groups, just to give both the Consul General and the rest of the audience an overview of what we are doing. Both Indian citizens and OCI holders have different situations ranging from expired visas, lost H1 jobs to medical emergencies or a death in the family, and people would like to know if there's any priority for these situations. There are questions about refilling Indian medical prescriptions by stranded Indian visitors, questions asking how the effect on the US economy will impact the Indian economy, opportunities for strengthening Indo-US economic and commercial relationships. This question is something that the Consul General and the Chamber constantly communicate about, because we are preparing for tomorrow when things come back to the new normal. And the last question that I had on my list was plans for vaccine. Does India have any plans for the vaccines being developed by the Serum Institute? And how effective does the Consul General think they will be? So with that group of questions in mind, I'm going to start off with the first question, which is, when do you think people can start coming in to get their affidavits or their notarizations done, Consul General?
So thank you for this question, Jagdipji. I think I should, in the beginning, at the outset itself, mention two things about consular services across United States and maybe many other parts of the world, but United States for certainly. Right from the beginning, and that from the middle of March, miscellaneous services like attestations, death certificates, birth certificates, things like your notarized documents. People have these kind of documents coming. So from day one, these services we have not closed. These services are very much running. The only difference now is that most of the services which we are providing, and rather all the services, we don't have walk-in services like with other US agencies. If you go to US ICS for a visa extension, or if you go to a US agency, they are also following the postal mail system, which is working very efficiently. On our website, we have a detailed procedure. It is very simple. For miscellaneous services, for example, you just have to self-addressed envelope and the fees. And in fact, in the last couple of months, hundreds of miscellaneous services we have already given and addressed. Secondly, on the other consular services, which is passports and OCIs. Now, these have also been normalized. And we have put out a press release, which I'll be happy to share with you through postal means. We are, in fact, almost back to our normal level of services, which was before the pandemic. We have currently, our outsourcing agency is also open. So we are trying to normalize things, and I can assure you that, especially on the consular services side, passports, visas, OCIs, attestations of documents, all these services are running and they are at full steam as they were earlier. The only difference is that they are all now online. And there is a procedure to follow through our outsourcing agency for all other services, and for the services which you mentioned, Jagdipji, the services related to attestations, documents and all, directly to the consulate.
Thank you very much. You've actually also answered the next question that I had about renewal of passports and OCI cards. The question was, I'm trying to renew my passport, which expires in October. How long will it take for the process? And since you said that now you're back to normal processing, I assume that if somebody applies for a renewal now, they will get their renewal by October.
So we, let me also mention that because of this pandemic, many people were caught here and they didn't anticipate that they would have to stay for so long, etc. So we are actually going out of the way to help people. If you send us a mail, if you're caught in a particular circumstances, passport, as all of you who are Indian passport holders know, we have a Tatkal service, we have a regular service. There was a huge backlog, I must acknowledge that. But even during the pandemic, emergency passport services were there. We were granting emergency passports on a daily basis to people who needed it for their visa processing, people who needed it for their immigration issues and other things. And finally, on the OCI cards, OCI cards, we are again, now we are granting, and OCI cards are also being given. So except for visas, and recently Government of India is also in phases opening up for visas also, there have been a lot of relaxations in the last 2-3 days. There are particular category of visas which even for foreign nationals we have now started giving on an emergency basis.
Thank you very much. Another question that somebody asked is, there is this misunderstanding that because Cox and Kings in India filed for bankruptcy, CKGS is no longer working. Could you please address that concern?
I will not answer the first part of this question because that is obviously their commercial thing. I really don't know. But as far as our service is concerned, 100% yes. Our website is working. You please see our press release. It is on our Twitter handle. It is on our Facebook page. It is on our website. CKGS is on behalf of the embassy and the consulate. They are delivering regular services like any outsourcing agency would do, and on a daily basis. In fact, we are processing hundreds of passports now. It's, in the last few days, the number is really rising every day, and we are giving a very large number of passports and OCIs all through CKGS.
Thank you very much, sir. That clarifies the question that I had received from two different people. Before I move on to the flights, there is one more question that you would probably like to address. Is any help available to get medicines from Indian senior citizens stranded in the USA due to the COVID-19 situation, whose prescriptions may have expired?
Absolutely, yes. But the only difference is now on medical prescriptions, you know, it is again something which we had not seen before, or maybe normally in normal circumstances, you don't get to see medical files of people, and it's a privacy issue, and we don't even want people to send their medical details. But there are many, you know, this question is a generic question, but it is actually much more nuanced, because I have seen in the last couple of months, people have reached out for some very rare diseases and rare medicines and things like that, you know, which are only prescription drugs, which are available only in few places. But having said that, we have the All-American Association of, you know, Indians of Indian origin. We have the India House here in Houston, which of course is doing it on a separate basis, but we have our own network of voluntary doctors in Nebraska, Kansas, Arkansas, and in Colorado, all over the 8 states we cover, and all over United States. So once we get a query, we try to connect you with one of the doctors, but 100% yes, there are doctors, voluntary India doctors, and that's why I mentioned at the outset that we are really proud of the fact that people have volunteered to help. They have done many telemedicine calls. They have done on a voluntary basis many calls on video links and all that, just to help people with their, not just their prescriptions, but even to, you know, consult with them. Of course, not for serious illnesses, but something which could be seen by the doctor. And on these prescriptions, they have really helped out many people. But on this, I would again suggest that if you have a particular query related to your own thing, you please write to us on our helplines. Our helpline numbers, Jagdipji, are widely available. They are pinned on our Twitter handle also. So please write to our helpline, the email address, and we will connect you to doctors who will help you.
So, Consul General, what we'll do is, once this call is over, we will share the helpline numbers through Chandrasekhar and Arup with the alumni group so that they can reach out to you. I'd also like to point out that we at the Chamber also have received several queries for help with medicines, and we've reached out to friends who are doctors, members of the Indian Doctors Association, members of API, who have been able to prescribe the required medicines, because you need a prescription to get the medicine. So they were able to help, and since there are people from all over America on today's call, I would recommend getting in touch with your local Indian Doctors Association, or your local member of the API, the Asian American Physicians of Indian Origin, and seeking their support in case you're looking for help with the prescription. Coming to the flights, when will commercial flights from India expect to open? What do US citizens need to travel to India, an OCI or an Indian visa? And can travelers arriving in India self-quarantine at home instead of at a government-approved facility? Those are the first 3 questions before we move on to the next set.
So Jagdipji, before I answer this question, let me just add the last bit on that medical prescription thing. On the medical prescription thing, I recommend that if you have an issue related to medical prescriptions, please send a mail, because there are fairly well-drafted responses which have a lot of information. So instead of your trying to reach out directly in any of the consulate or embassy helpline, send us a mail, and we will connect you to a range of organizations and doctors, so that you can pick and choose, and you can actually reach out to the right doctor and the right in your area, because this is a whole network across United States. Now on the Vande Bharat mission flights, which I thought I didn't mention in the beginning, because that is something we are getting almost three, as I said, hundreds of emails every day. But I'm happy to tell, and also through this webinar, tell people that we have already sent thousands of people to India through this mission. People ask us that when can I go and when can I reach out? At least I can say with some confidence that all over United States, the really pressing emergencies, the really compelling cases, we are seized of them. The process is fairly well laid out. We have a registration link, so whoever wants to go back to India has to register on that link. There are 8 categories of compelling reasons, which, for example, are medical emergencies, elderly, pregnant women, if you are a short-term visitor, if you have laid off employee, and things. So, students stranded here, which is a very large number. So we have a method in this whole thing, a very transparent, fair method, in which we try to address emergencies on a human ground, where there is a humanitarian call, a call of compassion. We try to put that angle also, and there are deaths in families which people can't anticipate. Someone's immediate parents have passed away, and we have dealt over this last period of since they started in almost a month now, hundreds of such people have been helped and people have gone back home. You must have seen on our Twitter and our Facebook handles, the number of flights is really going to increase. We are working on making the system even more efficient and streamlined. So please, if you are waiting to go, let me reassure you and honestly tell you that you will get home, and you will get home very soon.
The other part of the question was, when are regular commercial flights from India expected to open? Do we have any news on that?
So I wish I could answer that question, but I think that is a question which all countries of the world are facing. And there are countries in the world who are, United States, for example, has some flights going to some countries. India has some flights going to some countries. Every country is trying. This is a public health emergency, and on public health grounds, for the safety of all, because by now I'm sure whoever is in this webinar has read more about COVID-19 than he would have read about any disease or any other such disease in the world, because of the nature of what has happened and these lockdowns, etc. So it depends. I mean, I really can't say in time, but we are every day on social media, they are updating. For example, domestic flights have started running in India. They are running them with some precautions. They are running them to all destinations. There is a method to that. And I'm sure eventually, as the world comes to normalcy and all countries try to remove these measures which have been put in place, they have in a phased manner they are doing, and we'll keep you updated. We really can't time this, but it's an evolving situation, and every day I get up in the morning, I see some new development has taken place. In India, if you see now, we are now in a phase of the lockdown where a lot of things have been liberalized, a lot of things are being brought to normalcy, but also there is a need to contain them in the zones where, which are of concern. So obviously these are tailor-made solutions, and all countries are trying to do it in the larger public interest only.
Thank you. The next question was, can a traveler arriving in India self-quarantine at home instead of at a government facility?
So on the quarantine norms, there is a standard circular of the Ministry of Health and Family Welfare and Government of India. You have to follow that circular, which means that the 7 days quarantine requirement is there for everyone. And everyone, whichever destination you go, is further governed by the local quarantine norms. Which means that if you are traveling to, we have a flight going today from Chicago. In fact, from southern United States, hundreds of people are getting onto that flight, is going to Bangalore today. So if you're going to state of Karnataka, or if you're going to Mumbai, if you're going to Chennai, if you're going to Delhi, you have to follow the local government's quarantine norms, which means they have listed quarantine facilities which we share with passengers. They are widely available. There are well laid out procedures, but you have to quarantine for 7 days, which is the norm for everyone. And then they have recently made some relaxations, which means the next 7 days is home quarantine, but that also you will have to check with your local regulations.
Thank you very much. The next question is, what do US citizens need to travel to India? Will an existing OCI card or a visa that was issued be valid now that things are coming back to normal?
So on the OCI cards, I think this is a question which used to come very often just 3-4 days back when there were travel restrictions on OCI card. When we began, we had some restrictions. Let me mention that many people ask us and many people are concerned. There is no change in status of the OCI card. If you are an OCI card holder living in India, all your rights, all your things which come with the OCI card remain intact and they are as such. The only restriction was on travel. You couldn't travel to India on an OCI card because the visas had been suspended. But that has also been relaxed in the last couple of days now under 4 categories, which means if you are an OCI card minor child, and there are a very large number of people here, maybe in your BITS group also, that which are who are basically parents with Indian passports and children who are American citizens, OCI card holders. If your spouse is an OCI card holder and you are an Indian passport holder, if your family lives in India, if you are going on a family emergency, a death in the family. So these category of OCIs, you just go to India with the OCI card, but you have to register on our website and then you can travel to India on an OCI card. Visas, no. There are currently no visas which have been granted earlier. For visas, we have recently amended the guidelines and 4 categories, which are essentially health workers, first responders, in business category of specialists, and people like that who can travel.
So from what I understand, the first step for anybody who would like to go back to India for any reason whatsoever is to use the link to apply. And when they apply on that link, a lot of the questions that they have for us today will be automatically answered because they will be told what kind of visa, what kind of category will be considered for the flight. So is that correct, Consul General?
Let me just mention that our press release is very exhaustive, but as I mentioned, visas are not valid. So there is no ambiguity in that old visas are not currently valid. If you have an OCI card, yes. But if you have an OCI card also, if you fall in one of those 4 OCI card categories, as you are rightly saying, once you go on the link, you will have to, from the drop box, pick one of the 4 categories. If you fall in those, only then you can travel.
For the next question, I myself know the answer, so I will ask the question and respond with the answer, and then you can correct me if I'm wrong. The question was, Houston and Dallas both are international airports. What's the possibility of flights being arranged from these 2 cities? And because Air India has no flights to these 2 cities and Air India is the carrier, I understand that that is not going to be possible in the near future. Am I correct, sir?
I think the answer to this question should be a bit more nuanced from my side. There are 2 things. One is we are trying to start a flight from Houston, Dallas, which Jagdip, you are aware, to
Yes,
India,
sir.
which is a separate thing. But flights not going from here and going only from Chicago, New York, and SFO has been traditionally so. These are the 3 Air India hubs. But having said that, there is a flight going to Kolkata from New York on Monday. Now, Kolkata, it is the first flight from United States, so we are collecting pan-American passengers. So it doesn't mean that if you're staying in Houston and Dallas, you are the only ones who are traveling pan-America. If you are staying in SFO, also you go to New York. If you are staying in Chicago, also you go to New York. And the similar is the case for many other destination-based flights. So if you are traveling locally within United States, domestically, we cover states like Colorado, Louisiana, Kansas. So people from there also have to connect to some hub. As far as the Vande Bharat mission is concerned, we just have these 2-3 hubs from where the flights are currently going.
Thank you, sir. And now the next set of questions, you've already covered them, but I would like to just bring back to your attention some of the issues that were addressed of Indians stranded in the USA. A professional whose visa has expired and who has registered and is awaiting to be repatriated states that they have no income and their lease has expired. What is their priority, if any? Is it based on their date of application?
No, there is no, we are basically doing a random digitalized draw of lots because whoever, I tell many people that if you register on our link, you have to have a compelling reason. No one is registering on the link if you want to go for, any non-compelling reason, because from the Dropbox, you have to pick up a compelling reason. But having said that, I told you that there is a humanitarian phase to this exercise. It's the, there were cancer patients. There are cancer, some of the biggest cancer institutes of the world are based here. There are people who have deaths in the family. There are people like this particular case where visa is expired and all that. So we have actually, I think, at least I can say that for most of the destinations, of course, there are some destinations where flights have not gone because of no flights still going from here, and those also will be covered by the end of this phase two. By the end of phase two, we have our updated flight schedule, and then the phase three flight schedule is also coming. I, as I mentioned in the beginning, that we have already sent thousands of people. Number of flights are going in the next 5, 10, 15 days, and we are ramping up the operations. We are basically putting in a system where you will be able to get more flights. So many of these things, I'm really hopeful that most of the cases who are of emergency need and who are really hard pressed would be able to go in the next few days. I'm not even saying few weeks, but within the next few days. And in cases, if you are really in a true emergency and all that, as I said, we get hundreds of mails every day and we try to help.
So we have a situation where an Indian citizen came to the USA on a business visit, and there was a lockdown on the flight, so he cannot get back. So he does not have a real emergency in the sense that we've been talking, death or a medical situation or anything. He's just a businessman from India, stranded, like to get back.
No, Jagdeep, let me tell you that one of the compelling reason is a short-term visitor stranded. It is a good enough compelling reason. Visa expired, so it doesn't have to be a medical emergency alone. Those 8 categories include short-term visitors, visa expired category, laid off workers, students. So this business visitor who has come is very much on the list, and his chance will come to go. I don't know now which destination he wants to go and where he's based in United States, whether he's based in our jurisdiction or he's based somewhere else. So this I really don't know. But as I said, we have, in fact, covered a lot of people who were really in dire need and who were stranded. And now in the next 4, 5, 7 days, a large number of flights are going out. The flight to Kolkata is going out on Monday. The Bangalore is going today. Tomorrow again, there's a flight to Ahmedabad and all that. Then next week, there are many flights to Hyderabad, Chennai. So within the next 5, 7 days, you should hope to, see a much larger servicing of this whole category of compelling reasons.
Thank you very much. So this particular gentleman wants to get back to Mumbai, but I have queries from several different alumni who say that initially they had wanted to get back to a particular city, but now they're willing to go back to any particular city. So if somebody lives in Bangalore, can he get onto the Chennai flight or not?
Yes. So now in Delhi, for example, if you are ready to go to Delhi and self-quarantine in Delhi, you could go to any destination in India with a domestic flight. And Delhi is a hub for connectivity for many of the international flights going from here. You could also explore going to other stations and other places depending on your compelling reason. But Delhi, as I said at the outset, I told you that this is one destination where you go and from there you quarantine and then connect to your own other destination. And many people have gone in the past.
And if I understood you correctly, the quarantine in Delhi would be 7 days based on the state or the rules.
Yes, this is the 7 days is the central health government regulation. So 7 days quarantine is there for everyone.
But once they move, let's say from Delhi to Bangalore or to Chennai or to Calcutta, then they would have to follow the local quarantine rules of the city they fly in. Is that correct?
I think there will be local home quarantine requirements as well, because if from 14 it has been reduced to 7, so that they will have to check locally. Now, places like Mumbai, since you mentioned, you are well aware, Mumbai, I'm sure many of you or your alumni who are here today, they have relatives, they have friends in Mumbai, and Mumbai has its own measures for containment. Chennai has its measure for containment. They are also trying to, protect public health. So because of that, I think we should all understand the compulsions placed on the system also, because I tell people that, and I also tell people I cannot judge someone's need over another need, but I have seen in this last month or two that everyone is not equally placed, or everyone is not equally difficult, in a difficult situation. So we try to put a human angle to this, but at the same time, within India also, states have to quarantine people. They have to manage their own areas. They have to take measures to contain the virus. So all these, this is a complex situation which is being handled in a manner in the best interest of everyone.
Thank you, sir. Now, for OCI holders and US citizens going to India on family emergencies, whether it's a death or a healthcare situation, there is another unique situation. They would like to know how can or when can they come back, because getting there handles the emergency in India, but then what is the provision for people like that who go to India to come back? Are they given a seat on one of those excavation flights coming here to pick people up, or how would that work?
Absolutely. The evacuation flights are open on a commercial basis for inbound flights. In fact, today there is a press release. If you go on the Air India website and all that, the next phase of flights for inbound flights from the last, they have been coming full. Every flight which comes back from India is booked commercially, and a lot of people are traveling back to United States. So there are any number of flights now. All these evacuation flights which go from here come on a commercial basis from India.
So that probably answers the question of the next BITOSA member who says, my son is a US citizen stuck in India. My son's X1 visa allows him to stay until July 10. How can I get that extended? Also, what is the option for him to get back to the USA? So
so he should immediately look at these upcoming flights and the Vande Bharat Air India website. He should go on to that website immediately.
Thank you very much. Now, another question is about a student, as you mentioned earlier, who is here. He's an OCI holder, son of US citizens in India, and trying to get back because his sophomore year has finished. So he would be treated as one of the 8 priorities you mentioned.
No, I couldn't get. So he's an OCI card holder and his parents live in India.
I'll read out the question. Son of US citizen with OCI, living and employed in India. The son is a US citizen with OCI, is currently in Boston, having just finished his sophomore year. What is the procedure for him to go back to India? What is the earliest this can be done?
So if your family is staying in India, there is a procedure to follow. You please look into as I suggested, you please look into the registration link. And in the registration link, you will find a very well-defined, all the categories are very well-defined, who can go and who cannot go, which means if your family is in India, there is a category in that. But you will have to look into it and you will have to fill in the details. You will have to check all the columns. The second thing is on the outbound flights, what I just mentioned earlier, Air India is taking out a press release. Now the press release is up on the website. I strongly recommend that if you are looking for an incoming flight into India, they have set a time for the system to open. And they will, they have, I think, well advertised that. It is also on the Ministry of Civil Aviation, their Twitter handles and their website. Have a look at that. There is a particular time and a procedure laid down. So I urge you that you check all those details if you are wanting to come on an inbound flight.
Sir, again, my request would be if your office could send us that detail both to me and Chandrasekhar. I will distribute it to the chamber database, and Chandrasekhar can distribute it to the BITOSA database. So
yeah, sure. I will.
And with that, we've come to the end of the questions, basically concerning the flight and the other things. We would now like to focus a little on the US-India economy situation. The next question is, how will the US economy and its current situation impact the Indian economy? And I know both the chamber and your office are working closely on building that bridge, especially in healthcare. Can we take some time to talk about where you see things will move in the new normal when things move in that direction?
Honestly, I personally believe, I was in Geneva for almost 4 years in the World Trade Organization, and that was an area of trade negotiations. Here we are doing something which is more direct, which is investment of trade and investments between both countries. And Jagdip, you will vouch for it that the potential is huge. Why I say that is because there is a matching desire and interest in both countries. US companies, a lot of companies ask us, like they ask the chamber, like the chambers in here, for promoting business. The first parameter is that there has to be a matching interest on both sides, and that is something which you work to develop. We as diplomats, we go to different countries, we try to I was in Malaysia and we were doing a lot of commercial work in Malaysia. I was there and we had a very active partnership on trade and economic relations. We in fact had a CEPA also signed during that time. Then between India and United States, the canvas is very wide. In Dallas, in Houston, in Colorado, in big cities of United States, there are many people of Indian origin, Indian citizens, and American Indians who are connected with India on the trade and economic and business side. So we I think have to start building the blocks from there. And also we have discussed this earlier with many of our partner organizations to build and on areas where both countries have synergies, which means that if India can offer something to United States which is of value to them and it is a win-win situation, the connect is better. And healthcare, as you rightly mentioned, is one area where obviously areas like pharmaceuticals, therapeutics, and medical research, developing of manufacturing facilities. We have some big manufacturing facilities here, and energy is Houston is the energy capital of the world, rather. The largest corporations are based here, the companies are based here. Our trade with the United States has grown rapidly in the last couple of years. We have started getting a lot of oil and gas from United States. So information technology, and now we are here, we have these niche areas of aerospace, defense, and agriculture. I mean, that is one area. So all of you are entrepreneurs of some kind, or you're working in areas which are connected to entrepreneurship, or you have interest in those areas. So please help us in developing those ideas, connect with us. And I'm sure there is a lot of potential, and post this pandemic, I see a great interest in both countries to integrate more on our supply chains. You know, the global supply chains is something which India needs to integrate much more, and we are doing our best to get investments in particular areas so that we become part of these global supply chains. Indian companies and Indian chambers are working on those areas. Indian states are very keen. We in fact have 5-6 states who are very keen to connect with us immediately, and they have been writing to us that they want to present tailor-made solutions. They want to offer facilities they have. And India is one of the largest markets of the world. I mean, this is something which we all of us know, and in the future, this is going to be a big strength for us. As also for companies who are looking for talent globally, India has one of the largest pool of trained manpower, including people like from your alumni and other technical institutions. Education is a very big connect. Finally, you are aware we are trying to work on this skilling of people, of building vocational training, vocational institutes together. Those are areas in which institutions can connect with us and develop programs which are actually job oriented. Like in many parts of the world, vocational training programs are actually designed so that people get onto the job immediately. So these are some of the ideas, Jagdeep, but I'm sure this is not what is the focus of our webinar today, but still I'm happy to share at a later stage or sometimes whatever we are doing, and also use this opportunity to invite people from your alumni to come and connect with us and help us build this relationship, and also promote ties between in this part of United States.
Sir, the reason I was bringing up the economic angle was because from a chamber perspective, that is of paramount importance. And your presentation had covered most of the questions or all the questions that had been asked. So I wanted to use this opportunity to tell the alumni across America that anybody in any part of America or the world actually, is welcome to be a member of the Indo-American Chamber of Commerce. We work very closely with the Consulate and with our partner chambers in India to try to keep building on the bridge that we have created 21 years ago. And we keep reinforcing it. So we were responsible, for example, for bringing Mahindra to Houston And now Houston is the base for Mahindra tractors across America, Canada, Mexico. So we have been actively working on these relationships with India. And another opportunity that has risen for many of the investors who are alumni, the new opportunity is that with the current pandemic situation and the slowdown in local business here, there are opportunities to invest in as stakeholders into local businesses that are very successful but are slowing down because of a cash crunch. So in the past, when you had a lot of money, you would go out and buy a franchise. You'd buy 2 Burger Kings or 4 Subways. Now the opportunity is to come to Houston and buy into one of these local businesses. And we invite you to reach out to the chamber to see how we can help you connect with these people through the partnership and other relationships. Because we see that Houston offers you a unique situation. We have no state income tax in Texas. And for what you pay for an apartment in California, I can help you buy a whole neighborhood here. So sorry, Arup and Chandra, we are trying to steal some of your California alumni to our region, to enrich our region. With that, sir, I would like to take it back to you to make any final remarks. The one other question that was unanswered was, what plans for vaccine does India have? Because I understand that the Serum Institute and other institutes are working on vaccines. That was one question. And I have a couple that have been texted to me. So once you've responded to that, I'll ask you the last 1 or 2 questions, and then we can wrap up.
So, Jagdeep, I think on the trade and investment side, we have already discussed quite a bit. And as I said, the situation, once it normalizes, we will be working on many different themes and concepts. And many people from your alumni association who are connected with those areas can also connect and help us to promote trade and investment and look at areas of opportunities on that front. On the vaccine thing, we have a lot of potential candidates. As you know, candidates, there are many vaccine candidates globally. Each country is in a race to develop, and there are many global alliances which are trying to develop vaccines, and there are many between companies in India and United States. It is not that just one institute, but you must have read recently, it is again on our Twitter handles, there are companies who are working with Indian partners to either manufacture them, or there are companies in India who have been identified as one of the manufacturers for all these potential vaccines. We have had recently webinars with people, very highly qualified doctors from MD Anderson, Baylor, and from Texas A&M. So I will not venture into which vaccine would actually run past the post, but obviously once, I think the biggest challenge for the vaccine, any vaccine which actually is tested and which is found to be safe and all, will be to scale it up, because you will need billions of doses. And that becomes the challenge for any vaccine. And in that, I think India has a very big strength. We have institutes in India who are very pioneers in vaccine manufacturing and also who are globally renowned. Some of these institutes produce the largest number of vaccines for particular diseases in the world. So once you need to scale up, finding a vaccine is one thing, but mass producing is another thing. And then on the research side, already there are many ICMR and the National Institute of Health in United States, the CDC, they have a very big connect. We are working very closely with them, and many companies are working on a company to company level. So this potential is huge, and many medical research companies in India are looking at many other areas as well, including in manufacturing, as you are aware, on tie-ups for manufacturing of PPE, manufacturing of drugs, manufacturing of pharmaceuticals, medical equipment. So there is a whole range of cooperation going on in that area.
Thank you, sir. So there is one question that I think I would just answer. The question is, if Indian students in the USA right now, should they try to come back to India or to stay put in the USA for the next semester? I don't think this is a question the Consul General can answer. This had to.
No, but I can add. I can just add to them that we are in close touch with many presidents of universities. In the webinar we did, there were 2 presidents of universities here. Similarly, we are in touch with many institutions across United States. So for that, I think you should look for what the university or the institution guidelines are, because the institutions are seized of this question. They are more concerned about it than perhaps you are, because they have to run the institution and look at your safety also. And they probably will update you whether they will run classes online, offline, or whether they would call you actually on campus. So this would be governed by your local institution rather than anyone else telling you. That's my understanding. And as I said, there are groups of institutions who are looking at this issue, and they will probably work out something and keep you updated, because we keep discussing with them, and they are trying to see how best they can keep the student safety also in mind, and at the same time keep their educational standards also high, or at a threshold where they need to maintain it.
Thank you, sir. The last two questions, one is more of a comment to the question. I want to respond to the comment. The question is, my daughter's in New Jersey and is trying to get back home. She's a student. And my response is that if they have applied, when their turn comes, they will be called. Is that correct, sir?
Sorry, this is about which?
This is a daughter in New Jersey who's trying to go back to India, and she's just waiting to be
100%. You know, the message to her is that please watch out. I will share with you, Jagdeep, immediately once we have an update. The flights are being scaled up. We are trying to put a system in place. Air India has already put out a press release for some bookings inbound, and I think it will be very soon. Your daughter will be home. I can only assure you that, because there are a large number of flights which are coming up, and thousands of people have already gone. Many people have been serviced already, and I'm sure she will get back home soon. But last thing I actually wanted to ask is, just 1 minute, Arup could tell us what could be a better connect for this alumni association and our activities. Maybe Arup has some thoughts which he would like to just share before we.
So before I hand you back to Arup, who will be summing up, I do want to mention that one last question was, our parents are in India, they are green card holders, they are trying to come back to the USA. So my response to them would be, now that these commercial Air India flights are offering seats inbound from India to the USA, that's the route they should follow. Is that correct, sir?
They can come as quickly as coming Monday, I think. Even before we end this call, you go and look at the website, and there are so many flights coming in. I'm sure they can.
So, sir, with that, my role as a moderator is over. I'm going to hand it over to Zutsi. But I first want to thank you for making the time in your busy schedule. I also want to thank you for the great work you've done ever since you've landed in Houston, because you came in the third week of January.
Right.
Very soon after that, things started changing. So we commend you on behalf of the community for the great work you do. You're available whenever we call you, and we appreciate the work you're doing. Back to you, Arup.
Thank you very, very much, Jagdeep ji, and thank you, Honorable Consul General of India at Houston, Aseem ji. Thank you so much for your insightful, your patient handling of the questions. Let me answer your question for me. Obviously, on behalf of the alumni, which is fairly large, even in the US, there are multiple ways in which I think the alumni can connect with the Consul Generals and with your office, both on the commercial side as well as on humanitarian side. Many on our alumni are actually entrepreneurs who are job creators. They have a lot of technology companies. So if there are people who are reaching out to you, especially many who have been affected because of downsizing or right sizing, one way for them to connect with us would be to come and connect with either Chandra or myself, or go to our BITOSA global site and send questions, and we will be able to make connections with our alumni. So our goal is to help the Indian community at large, and of course anybody from our own alumni that gets affected because of this current crisis that they're going through. So that's on the business side. So we can certainly help. We can work with your office, and we can support on the humanitarian side. If there is anything we can do in terms of helping people, supporting people, providing for funding, medical support, all of those options are available for us as well, and we are happy to support anybody who wishes to reach out to us and connect with us. We are still working on some logistics of how we can make it more proactive. We haven't been able to do that, but hopefully very soon. But you are so well connected with the Indian community at large. Look at us as a plug-in, a resource, and we would love to engage, work. Jagdeep ji is right in your backyard, but as a community, we are very strong and spread all across the country. So I would offer our alumni to your organization, to your office to help and support in any way possible. And between Jagdeep ji, myself, and Chandra, we can handle all of these local issues. So that's what I would like to offer and respond to your question.
Thank you.
So with that, of course, thank you very much to everybody for joining us today. I always say a good session, and by the way, we've got some incredible feedback. This session was also live both on Facebook and on YouTube. So these were happening live as we were doing it. I always say a good webinar is when, besides the host and the speaker, we also have a great moderator. So I must thank Jagdeep ji for being a fantastic, passionate moderator, alumni of our BIT MESRA. And I'd like to encourage all the BITOSA alumni folks who are on the call on this platform and other platforms to come join us in this journey. I think this is a very, very fabulous platform. It's had so much positive impact to our alumni and to the Indian community at large. I would also like to thank the team behind the scene who have made this possible. We have a BITOSA global team based in Silicon Valley. Chandra is known to everybody, but we have people in Bangalore, Varun and Ramesh. We also have Neha Vatsala in Pune and Abhishek Sinha in Delhi, and many other people who have supported this. So I want to thank them. And finally, of course, I want to thank the Consul General once again, and of course, our entire alumni, our strong alumni, our great alumni, for being with us today. So with that, please be safe. Thank you, everybody, and take care, and we'll be in touch soon. Best wishes, and bye-bye.
Bye. Thank you.
Thank you, everyone.
Thank you.